emergency.
Yes, sir, we are live.
Okay, thank you. Okay, as president of the board of the Jefferson County Health Department, I'm going to call the regular October meeting of the Board of Trustees to order. Can we have a roll call, please?
Mr. Deal,
Here.
Dr. Henry,
Here.
Mr. Prater,
Here.
Mr. Pig,
Here.
Ms. Davis.
Here.
Okay, I'm going to
Mission, JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. The vision is enhancing the health and safety of Jefferson County.
Okay, thank you. Next item is call for the order of the day, the approval of the agenda.
Mr. Chairman, I have a couple of addendums, amendments to the agenda, please.
Okay,
The first one would be under new business. Number 2, if we would please remove that. And then under closed session,
I have a copy of the agenda today.
moving forward, I would like to close session, add number 4, which is to include section 610.021- or .1, as well as .2, legal actions involving a public body and its privileged discussions with its attorneys and purchase of real estate. That'd be my amendment.
okay, so we have a motion to amend the agenda. We have a second.
I'll second.
Okay, we have a second discussion.
Just curious why you're doing that? What's the significance of that?
This was at the request from our attorney.
Okay,
So it wasn't, so you're asking exactly what to be done?
My motion for the second time is new business, under new business, remove number 2. And then under closed session, add a number 4 to include discussion with our attorneys on the purchase of real estate.
Any other discussion? So we have a motion and a second to amend the agenda. All those in favor, please say aye.
Aye.
Anyone opposed?
I'm opposed with reason that, it's not on here to discuss it, so we shouldn't be discussing it.
Discuss what?
The real estate.
It is on the agenda.
Okay, I'm sorry. I'll withdraw that.
Okay,
I'm sorry, sir.
go ahead. Okay, so that amendment passes.
I make a motion, we approve the amended agenda.
Second.
Motion to approve and second the amended agenda. All in favor, please say aye.
Aye.
Opposed? Okay, that motion passed.
It stays on.
Okay,
It's
Thank-
live now, sir.
okay. Okay, so we have 5 items of minutes to approve, minutes and expenditures, I'm sorry. So the first item is approval of the September 24th, 2020 tax rate meeting minutes.
I make a motion to approve.
Second.
Okay, we have a motion and a second to approve those minutes. Any discussion? All in favor, please say aye.
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 Anyone opposed? Okay, those minutes are approved. Next item is approval of the October 15th, 2020 special meeting minutes.
Motion to approve.
Second.
Okay, so we have a motion and second to approve those minutes. Any discussion on those? Okay, all in favor, please say aye.
Aye.
Anyone opposed? Okay, those are passed. Okay, and now we have approval of some expenditures. Approval of the September 2020 expenditures.
Motion to approve the September 2020 expenditures in the amount of $250,670.23.
I second.
Okay, a motion and a second to approve those expenditures. Any discussion on those? Okay, all in favor, please say aye.
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 Anyone opposed? Okay, so those September expenditures are approved. All right, next item is approval of the September 2020 electronic payments. And
Motion to approve in the amount of $426,406.39.
I second.
okay, so we have a motion and a second to approve those electronic payments. Any discussion on those? Thank you, Mr. Prater, for supplying the figures.
You're very welcome.
Hearing no discussion, all in favor, please say aye.
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 Anyone opposed? Okay, those electronic payments are approved. And last approval item is pre-approval of the November 2020 electronic payments.
Motion to approve the November 2020 electronic payments in the amount of $489,608.25.
I second.
Okay, we've got a motion and a second to approve the for pre-approval of the electronic payments for November. Discussion on those.
We were supposed to receive itemization of the CARES Act money, how it's being spent, and where's that?
It was emailed to us.
Yeah, I think everyone received that in an email.
And September's is in your packet.
Yeah, September's is the last page. Attached to the agenda.
Are the marquee signs on there as well?
Point
We
of order,
don't
does
have-
this have to do with the November electronic payments? Because we have a motion on the floor to vote.
The question is whether that's included. Kelly?
Marquee signs aren't included in the November expenditures.
Then which one is it included on? October, September, what? Maybe you could point it out to me.
Ms. Davis, you received an expenditure itemized by each of the expenses that we've had for the CARES funds. That was emailed to your email address. So that would be included in the packet that you have already received. I do not have a copy of it in front of me, so I cannot go backwards and find it for you.
I did not receive it, so I'd like to see it. And if you give a moment, I'd appreciate to resend it to me because I do need to see it. I specifically asked for it at the last meeting.
We'll do that. Everyone else got it. So I'm not sure what the problem was, but we'll make sure you get a copy.
I appreciate it.
Okay,
Thank you.
So we have a motion and second for the pre-approval. All in favor, please say aye.
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 Anyone opposed? Okay, thank you. Next item is the director's report. Ms. Vollmer?
I've got a couple of things I'm going to bring to the table today. The first of which is, Tim, I'm going to borrow your copy, but I'm going to ask that you pass these around. The Missouri Public Health Foundational Services. These are the services that define what public health does as an agency. So I think there's been a lot of confusion among the community in terms of what public health's role is. And so I would just like to take a couple minutes to give you an overview. We've been actively involved in the Transforming Public Health in Missouri for the past year and a half. And this is the new model that we're looking at. It is based upon the Public Health Accreditation Board as far as at the federal level. What are the services that public health should be providing in a community in order to be able to help their populations live healthy lives? One of the things I want to clarify is that public health is about treating populations. It's not about treating individuals. So medical doctors and hospitals will treat an individual patient, and they will work with them to invest and help to improve their symptoms in their lives. Public health is instead concerned about entire populations. So in the strategies that we use and the types of work that we do is focused on a larger population and how we can work long-term to create healthy communities. So the types of skill sets that are involved in doing that are listed out here, basically things looking in terms of communicable disease control, which is what's prepared us for working with COVID. Environmental public health in terms of restaurant inspections, water testing, maternal, child, and family health, looking at wellness exams, children's immunizations, family planning, injury prevention. So that's where our drug prevention work, our suicide prevention awareness, our mental health services that we work with children, and things like our bike helmets and car seats come into play. Linkages to medical, behavioral, and community resources. So rather than being the source to be able to provide clinical services, we are the linkage to those services. It's helping connect people to services that they need and helping to connect them to the resources to be able to access those services. So looking at how we can help to get individuals who may be uninsured connected to the mammogram ban, helping to connect folks who need assistance with mental health issues and connecting them in with our community sources. So it's really important for us as far as being that center spoke in terms of our center hub to the spokes, because our relationships are what really are engaging and giving the impact in our community, as well as chronic disease prevention, which most people have heard from the last 10 years, probably in terms of eat right, physical activity, don't smoke. That's kind of that along those lines. But in doing that, we've got several ways that we can go about protecting the public. One of that is assessment and surveillance. So the surveillance that we do for influenza, for COVID, is what we also are doing for things like watching our chronic disease rates and working with the hospitals to look for any kind of trend that's ahead of time. Our emergency preparedness and response group worked with local communities, including our schools, to prepare for everything from terrorist attacks to fires to a flood. Policy development and support is a main component of public health. Communications, community partnerships, looking at our performance management and accountability. So again, looking at how, not only what are we doing in the community, but what kind of impact are we making? So I just wanted to put those out there as that public health is much broader than I think many people think that it is. It is definitely a multidisciplinary field in which we have very unique characteristics and skill sets that we bring to the table. So just wanted to make sure that you had that model. The other thing that I wanted to bring to the table is, I believed I may have to steal, Amber, I'm going to steal yours. Can you pass that down? I can steal yours again. That's yours. You have that one already. So I wanted to bring to your attention yesterday's Post-Dispatch. The headline was hospitalizations again on the rise. Concerns grow as overtaxed health workers and about quality of care. So in talking with, as many of you know, I sit on the pandemic task force. We meet weekly multiple times a week to discuss the current COVID situation and what our resources and capacities are. With that, the county executives, the county health directors, and the medical directors from the major hospital systems are all talking on those calls and trying to coordinate our efforts. This hits what Dr. Garza has really placed out there as what we're calling a perfect storm in terms of the significant increase in cases of COVID. The hospitals in the outer regions, so the rural areas, are starting to become overloaded. And so they're starting to push their capacities into the St. Louis, Missouri area hospitals so that they are able to meet demand. You're having the influx of the staff issues. So what we're starting to see is not only we're starting to see staff who are quarantined or who are getting community acquired illness, but you're also starting to see that impact staffing ratios at the hospital, which impacts their capacities. What we're also at is we're in the first week or two of flu. And so I think there's a lot of pieces that are coming together. And so I just want to keep everybody mindful of the fact that as we look at the system and as people talk about not wanting to overburden the system or not wanting to, quelling the tide basically of COVID, we've been talking this whole time about it starts small, and when we can make a difference here when it's small and it's building. And then we started to see it with our cases and our contact tracing and being able to keep up and do those things. Now we're seeing it with the hospitals, and they're at a point where they're able to keep up, but they're really starting to be stretched. And so they are putting out a call for our assistance and for the community to listen to public health measures in order to be able to mitigate this rising spread and to try to control it so it does not extend the hospital systems as we've worried about before. But the number of cases and the number of hospitalizations they're seeing now are very comparative to the very beginning of the epidemic. Finally, the last piece of paper I have is just to give you the St. Louis Metropolitan Area COVID status indicators. This is a document that the Pandemic Task Force puts out in terms of just tracking the overall indicator. So they're looking at COVID bed capacity, new admissions, weekly changes in reported new cases, prevalence of reported cases per 1,000, the RE number and the positivity rate. And all of them have all of them are in the either yellow or red, significantly in the red. And so we are wanting to start looking and trying to find ways to get those trends down. I'll pass them out rather than try to go through the numbers for you guys. But just wanted you guys to have them to be able to take a look at and go further. So I appreciate it. Ms. Davis, are you feeling okay?
I'm fine. I need to address several of the things that you mentioned. So can we have a discussion? Would that be okay with you, Dennis?
Have a short discussion.
Okay, first off, you mentioned the hospitals being overwhelmed. They are not. That's not statistical. If you're looking at the St. Louis Pandemic Metropolitan Task Force figures, which I have open on my phone right now.
Mhm.
Okay. The worst it was in mid-April.
Mhm.
There were 40 some odd people COVID hospitalized at that time. And now there's probably less than 10
You
per
do realize
hospital
that's- I'm so
COVID
sorry. I
hospitalized.
apologize.
How could that be overwhelming? And how could that be as bad as it was before? I think that's inaccurate. And this is a public meeting, so we need to make sure we're getting accurate data.
Ms. Davis,
Out
she was
to the
quoting
public.
a newspaper article. So who are you saying is inaccurate?
The St. Louis Post-Dispatch has done a lot of inaccurate articles concerning COVID hospitalizations. So,
That's fine. I
we can't go
disagree.
by this, but we could go by what the Pandemic Task Force
Okay,
on their numbers are saying. And that's what I'm referring to.
let's move on, please. Go ahead.
Well, Kelly, well, let's dissect that just for a moment. It only takes a moment to do it. the actual data today
Mhm.
from the St. Louis Metropolitan Task Force says, you want to open it up on your phone or?
I would love to open it up on my phone because I've also been in touch with Dr. Garza. So I would love to hear your interpretation.
Okay, so what are you showing for how many people are hospitalized COVID today? Out of 22 hospitals, what are you showing?
What you're looking at, I'm assuming I'm having to pull up my list here. Inpatient confirmed COVID hospitalizations are at 355 today. Straight from the St. Louis Metropolitan Task Force.
Hang on one second here.
I'd really like to move the meeting along.
Well,
So
we-
what,
there was a statement made there that things were becoming overwhelming, that the hospitals were filling up in the rural areas and it was going out into the hospitals towards the cities. That's not accurate because I was looking at all of the charts on Missouri's site
May I
last
please?
night.
I'm sorry.
And on those charts, it was saying that there's over 40 to 50% capacity in the ICUs, in the hospital beds, and on vents. So that is not a problem.
Mr. Chairman.
yes,
I go ahead and recognize.
Just
that-
saying.
I think we need to, as a board, recognize that Ms. Davis does not agree with the information given by the director, and I'd ask that we move on from this point. Thank you.
or by the task force, apparently.
Can we please move on?
Yes. Okay,
With that point, we can move on.
all right, thank you. Okay, there's no old business on the agenda. New business. Kelly, can you speak to that, please?
So the board received information. We've actually had You just told me to turn it off. The board has received information both prior to the last board meeting as well as prior to this board meeting regarding the need for contact tracing assistance for the health department. We have contact tracing has been happening internally with our staff, probably of the 88 staff. We've got about 65 or 66 that are reassigned to that task at this point in time. And when I say contact tracing, that means everything from the initial investigations to follow-up and contact tracing of individuals who would need to be quarantined. With the severe increase that we've seen as far as our caseload, we have been unable to keep up with the number of new case investigations that we need to do. So in looking at the initial calls need to happen within 24 to 72 hours. The importance of that is that you've talked to not only the individual, but you have identified contacts, which gives you the ability to be able to identify those contacts, quarantine them, and take them safely out of the potential for infecting other individuals. That's the way you get in front of this. Unfortunately, with not having the ability to stay in front of such a large caseload, that is growing in our community because the contacts aren't getting quarantined. So we reached out to several of our community, of our LPHA partners and had looked for recommendations of groups. Several of them have used this particular Maximus Federal Services and they're currently engaged in work identical to ours. We went through the state procurement process. So the state sent out a request for bids and those were received back prior to last meeting. What you have in front of you is the approved bid for Maximus, which allows us, the state allows local health departments to contract underneath state contracts utilizing the same GSA rates. Maximus has given us their quote that it would be, I believe, we've asked for 13 case investigators and 15 contact tracers in order to be able to get through December to try to catch up with our initial investigations. With that being said, what we are asking for this initial engagement is strictly to use CARES Act funds. And so to contract with Maximus through December 30th. But what we would be looking for is, one, if there's additional funding that would come through from the federal government to be able to assist with the payment for services, I would recommend that we would do that as a continuance. But this gives us also the ability to regroup and decide in December if this is a contract that we would like to move forward with if we do not have additional funding. But by then we would know what our funding options are. So I'm placing this before the board for approval to contract with Maximus for the date of October 22nd through December 30th, 2020.
I do have a question. I know this may be trying to put a crystal ball on it, but do you have an anticipated estimated amount of dollars? I'm sorry, I didn't see that in there. Did I miss it?
Yeah, it's on Exhibit C.
Thank you.
There you go.
No, I'm talking about an in dollar. Just is,
Top right is the
okay. Well, thank you very much. Thank you. That answers my question.
And actually that I believe was a 3-month estimate. And by the time that this goes into effect, it'll be 2 months. So
How much? What was that amount?
on the sheet.
And one thing I'd like to make folks aware of is that by going through the state contract, we'll be getting the best price we can. And if I'm not mistaken, avoids the need to go out for bids, correct?
correct. The other piece to, this will also allow us to start resuming our normal services. So being able, we've maintained normal services throughout, but they have been limited in scope. And so this will allow us to start pulling more of our staff back in to be able to provide those traditional services.
So
It just expands capacity.
I apologize. I do. So my question, I know this may be a little, again, you may not know the answers, but how much of your staff have deferred like vacations, time off and that sort of thing?
All.
Oh, okay.
Okay, so can I have a motion?
We need more discussion. Here's a pile of paper on,
You can have discussion once we have a motion.
why do we need a motion to have discussion? Just asking.
Robert's Rules Order.
That's the way it works.
Okay,
I make a motion that we have a discussion.
Your mic is off.
I move that we have discussion, open discussion on this matter.
Until we have a motion, there can be no discussion. So
I just placed a motion on the floor to have a discussion about this matter.
do we have a motion on the contract?
I'll make a motion to approve the contract through December 31st, 2020 with Maximus.
I second that motion.
Okay, so we have a motion and a second, so we can have discussion.
Okay, I was just doing some, could I be recognized, sir?
Oh, sure.
Okay.
Your mic is off.
I was just doing some calculations, on the St. Louis Pandemic Task Force figures.
Are we
at
talking
three-
about the contract?
It relates to it.
Okay,
Okay. Right now, we're in the orange zone, which actually we're in the yellow zone, according to the White House the White House metrics, because we've never been out of the yellow. Okay. Worst case, we've had
disagree with
31.
that. Go ahead.
We've had 30 something cases in mid-September that you record on your website on your color chart. And those cases, according to the White House metrics, have us in the yellow zone. And we've never been in the red, and our hospitals have never been overwhelmed. In fact, right now, 56 people came into the hospital yesterday or today, and 76 people went home. The average hospital stay And I know you're laughing at me over there, Kelly, but the average hospital stay, according to your office and your guidance and the lady, Sarah, that does the video, says the average stay for COVID is 2 days.
Ms. Davis, this is not relevant to the
So it is
contract.
relevant
No,
because
it's not.
we're talking about a how many $1 million contract? To contract Trace, how many?
Mr. Chair, may I have the floor?
Yes.
Thank you. One, I would ask the chair that the information that is being presented has, one, not been vetted to the board prior to be accurate. Two, I would request that the board ensure that the accurate information that is being presented be presented to the community upon the end of this call, because the White House Task Force actually has the Jefferson County in red right now.
No,
as
they
of This
don't.
week. I have the floor. And I would like to ask that we have significantly extended our agency resources beyond our capacity to be able to assist. Ms. Davis has already previously asked that we not only return to normal and get our normal business operations and services open to the public, but that we also hire an outside contracting firm. She would be in full support of that. So I am just asking, sir, that be taken into consideration when we are looking at these contracts moving forward.
Well, according to these figures that was just passed over to me, we're talking what, $5 million? How many? 2? I just looked at it real quick. This is what we need to discuss. And this is an open meeting. People are listening to this. They want to know how much money this is going to cost.
And I appreciate that, Ms. Davis, and everything has been sent to you prior. So I'm happy to continue to look for it within here. I will find the page.
It says 1.63 million for 3 months. And this is going to be paid through by CARES funding, correct?
And
Correct.
for 2
3 months.
Not-
For 3 months.
we've
CARES
already
funding.
passed.
1.6 million, almost 2 million for 3 months.
No.
Is that correct?
No, 1.6 million for 3 months, and we're
That's
only
what I just
asking for
said.
2 months.
Yeah, the motion to approve is through December 31st, which would be
Right.
what?
And this
10
deals, this deals
10 weeks.
with cases of COVID. It does not deal, or it doesn't strictly pertain to people in the hospital. We're looking at reported cases. We're looking at doing contact tracing on them. So again, I'm not sure why you're talking about hospitalizations.
Because do we really need to do this?
Yes, we do. It's basic public health.
Okay,
Everyone is doing
If
it.
we need to do it, okay, and our numbers are coming down, we've gone from red to orange, which I say we're still in the yellow. We've never been in the red,
We'll
okay?
discuss that after.
And
the
I can
meeting.
prove it, okay?
Uh,
And I do have the
I think
charts
you're
to
mistaken.
show you.
That's false.
Let's move on,
statements.
please.
It is not false. You know,
Are we we're
the
discussing
discussion
this contract.
I have the floor, sir.
Well,
Okay. So in this discussion, what I think as a board member, we need to think about is the amount of money we're spending and what is it going to do to the people? Okay. So let's use a scenario. Say someone tests positive for COVID and in actuality, they have some mild symptoms or none. And just because they tested positive for COVID, they happen to mention Amber, who maybe they don't like Amber for some reason or another, and they just decided they would mention her, and so a contact tracer could actually send Amber a letter stating, Amber, you're to quarantine, be isolated, whatever, for 10 to 14 days, whatever the amount of time is. And so, it could affect Amber, her family, her job. It could affect children in school. It could affect children going to school, trying to play a sport. And the kid on the bench next to him, where he was sitting last night, just happened to test positive, which, by the way, after 14 days of another child having the same issue, there were no symptoms, there were no problems with it. And now there's a contract trace going out that we're spending $2 million of COVID CARES money, whatever. And why are we doing this? How
Because
important
it's
is it?
Basic public health.
Basic
It's
public health
basic
is our
public-
basic public health is not in dire straits with this. This
We're
is
in-
affecting
Ms. Davis,
people
we're-
in
we're the
long-term
middle-
skilled
Isn't there a
care
Department of
we're
Health and
centers.
Senior
middle of a
Services order
pandemic. Do you
for
In the
understand?
middle
contact
of a
tracing for the ages of 0 to
pandemic
21?
that
Yes.
is affecting people
Okay.
Chair,
that
point of
have
order.
comorbidities
Point
that
of
are 80
order.
years old.
Point of order, Chair, there is I just want to mention that there is a Department of Health Senior Services order that contract tracing must be done on infected patients between the ages of 3 and 21. Thank
Okay,
you.
that's true. I'm going to limit discussion on
Well-
this. So I'm going to bring the question. We have a motion and a second.
Point of order.
So I'm going to call.
Point of order,
I'm
sir.
gonna call the vote.
Point of order.
All those in favor of. the,
Point of order. You have to recognize a point of order.
The chair does
Okay.
not.
The
Point of order,
point
the
of
chair does
order
not.
is, as a member of this board, I am allowed to speak for 10 minutes if I wish to speak.
You can.
And I'm
vote-
not done.
You can vote on.
You're ready to vote on something that could affect people's lives, their jobs, their children's playing sports, going to
Right.
school,
all
and now
those-
having to stay home because they're supposed to be going in person and now somebody's tested positive and they
I
can't go.
understand you're opposed to this. It's basic public health. We're voting on the motion. All those in favor of the motion, please say aye.
Aye.
Anyone opposed?
I'm opposed.
All right. The
I'm
motion
opposed.
passes 4-1. Okay, next item, please, Kelly.
I sent an email to the board members on October 13th. The fourth Thursday in November is Thanksgiving, and the fourth Thursday in December is Christmas Eve. So I did get responses. So the November meeting will be Monday, November 23rd at 3 p.m. And December's regular meeting will be Monday, December 21st at 3 p.m.
Sorry, could you please repeat that?
You'll send this out on
I will send out,
You'll send us an invite,
yes, I will.
email invite as normal.
November 23rd at 3 p.m. and December 21st at 3 p.m.
Mr. Chair, do we need a motion to approve those meeting date changes?
I'm not sure.
I'll go ahead and make that, I'll go ahead and make that motion.
I'll second the motion to change the November and December meeting dates to 11/23 and 12/21 respectively at 3 p.m.
Okay, and we're changing those because of the holidays.
Correct.
So I have a motion and a second. All in favor, please say aye.
Aye.
Anyone opposed? Okay,
Did you just change it from December 21st? No, still at 3 p.m.
okay. Thanks for the heads up on that, Jetty.
I can't believe that, I'm sorry, but I can't believe that we made the decision on this package of paper that's about 2 inches thick in a few minutes when we needed to understand more. In fact, I'd like to have seen a
Point of order,
presentation
Chair.
from the man
This
who
isn't
is
on the agenda.
with a face on who this company is. I'd like to see him, talk to him, ask him questions. Why were we not able to do this? It just doesn't make sense. What's the big
This-
hurry?
This is time sensitive. We've been putting this off for some time. It needs to get done. We can only spend CARES money through the end of the year. So again, I'm just going to cut off discussion on that.
What do we care
So-
about that company making $2 million, a little under $2 million?
Mr.
If-
Chair, may I have the
Yeah,
floor?
what do we care about that? Don't we care that our numbers are doing better, that
Ms. Davis, you've been saying that since March. You've been incorrect ever since.
I'm
then.
not incorrect.
Mr. Chair,
I
I'm
can
gonna go ahead
show
and make
you
a
where I'm
motion. that We go
right.
into closed session
Yes.
pursuant to 610.21, including sections 1, 2, 3, and 13.
I second.
Okay, so motion second to go into closed session. All in favor, the aye, please.
Aye.
Anyone opposed? Okay, so in order to go into closed session, we need a roll call vote, but we're gonna stop the online viewing.
It's gotta be roll call, doesn't it?
Right, but then come back on afterwards. Okay,
Watch the stream, and when you guys are done, I'll bring it back live for the open session number 2.
okay, very good.
Mr. Deal,
Here,
Dr. Henry,
yes.
Mr. Prater,
Here.
Mr. Pig,
Yes.
Ms.
Harry.
Davis.